We've begun. They don't want to hear this nonsense. this is this is Friday syndrome. Ladies and gentlemen, mesdames et messieurs, mein Herren and mein Herr, let us stop. All right, we ready? Good. Nice hearing it. This is where we kind of left it. Now, hey, it's always Brooks' fault. God, you're a troublemaker. Yeah, I mean, I should. You should make friends with my daughter because we have a lot in common in that regard. Being a problem child. Okay, I posted this. I found this is an outline I hadn't had in a while. I sort of lost track of it, but found it this morning. That helps with the virus chapter a little bit, and then I will send you the other one that we're looking at here. So I wanted to go back and start with it. The big problem with DNA viruses and herpes, HPV and herpes are the reason for for this discussion. Is the idea of once you get them, you get them. They're not going away. You always have them. Most of them are transmitted, with the exception of chickenpox, typically in secretions like saliva, maybe genitally based fluids. Okay, those are typically the way they are secreted. And some of them are respiratory as well. Because when you think of respiratory, when you cough or sneeze, think of this vis-a-vis mononucleosis. When you cough or sneeze, you're putting out mucus and saliva as part of that, and to a certain extent, so there's almost like a respiratory component as well as a close contact component. So a lot of these, there's more than one way that we spread them. So typically, we're going to classify them as by blood and body fluids. In the case of saliva, and this, where I think the only one of these I would even consider to be pure respiratory was what we're going to talk about next, is chickenpox, shingles, or varicella zoster. So again, we're going to revisit the herpetic, that's the name that we give them, herpes simplex or HHV1 and HHV2. They're similar. Again, you can get location non-specific. Depending on the area of contact, you can get one in one area and one in the other area. That's a variable that's there. In general, how do we identify genital herpes? And we revisit this again, is because the initial lesions or the initial blisters and sores from the first infection are typically fairly painful, which is unusual for these. Okay, particularly when they occur in the genitalia. And we'll look at this in sexually transmitted or infections when we look at that particular chapter toward the end of the semester. Again, you heard me introduce this. It's respiratory. Now understand, if you'd encountered somebody with chickenpox, if you encounter, and you will, somebody with shingles, okay, you can't get the shingles. You can't get. You have to have had the chickenpox. It's the idea of this particular latent infection. Get the chickenpox to start. It becomes latent in your sensory nerves. For whatever reason, typically with something that causes your immune system to flounder. It doesn't mean you're sick or you're going to die. It could be, like I said, social trauma, loss of a loved one, going through a divorce, that kind of stuff. Maybe being in a big traffic accident, somebody gets hurt. Yeah, and I'm citing you these because these are the ones that I happen with patients of mine. And all of a sudden the shingles come out. Sometimes they come out for no reason whatsoever. So if you never had chickenpox and you were never immunized for it, and you came in close contact with the shingles, which is on the skin, what you would get would be the chickenpox. That's got to come. You can't transmit the shingles; they're non-transmissible. You have to give them the chickenpox first. It's kind of an interesting nuance with regards to that. But all of us, effectively, during our lifetime, are exposed in some way, shape, or form to varicella, chickenpox. We'll look at this when we look at this. And revisit that again. So that's maybe the oddest one of this group. The other ones are fairly straightforward. Epstein-Barr, the source of infectious mononucleosis, clearly is spread by secretions in close contact. It's typically in saliva more than anything else that's there. Again, for all of these diseases, and that was sort of the point I left it with last time. When you get these things like chickenpox as an adult, Epstein-Barr as an adult, when it recurs, much more severe, they're typically characterized by high fever. The younger you are, the more you can tolerate high fever. Viruses, if you wanted to paint with a very broad brush about typical viral infections, fever, rash. Okay. A baby with 104 fever is not going to get them admitted to the hospital. An adult with 104 fever likely is. It's a whole different thing. Children get sick very quickly and severely, and they get better. Babies also. If you did not know that, if you go into children's hospital, a baby with 104 fever, that baby's not getting admitted unless they can find a reason to admit them. The first thing I tell all the classes, the first thing I do, interestingly, let's say an infant. Oh my God. Parents there, they're panic stricken. The first test they do is a urinalysis. Okay? The reason they do a urinalysis is because typically an infant's not going to be able to tell you, and it's fairly easy to get a urine specimen and see if there's a hidden urinary tract infection. Okay, diapers, things like that. You kind of get the idea. If that didn't tell them that what the source of it was, they do a chest X-ray. We still haven't done a blood test. Okay? The chest X-ray will be able to tell you if there was pneumonia or some type of significant respiratory problem. Then that would make the diagnosis. Then they can proceed from there. By that time, aren't we going to do blood tests yet? If you haven't got an answer for 104 fever, the next test you do is a spinal tap, lumbar puncture. Because by that time, you better be making a determination whether we're dealing with bacterial meningitis, because that baby could die. Interesting that probably at the same time you do blood tests, but you've got to find out right now if we're dealing with something that is immediately life-threatening. Then you can start doing the rest of the workup. That happened to the one I showed you the picture of, 41 years old, okay? Happened to us. I'll tell you the story when we get to this particular virus that associated with that one. It's very scary as a parent. Okay? So if the kid is 104 fever, they're going to send them home on Tylenol, maybe alternating with ibuprofen, that type of thing. Once they establish, okay, this is whatever is going around, whatever viral disorder is going around. And we've established that it's not something immediately life-threatening. Not so with an adult. Give you an idea. So as you get into your clinical careers, many of you who are going in that direction, you'll learn about these things. Okay? Because the last thing you need to be is excited, because if you're excited, then the parents are going to be over the top. Okay? You got to be calm in the face of that kind of adversity, because they take their clues from, if you're going, oh my God. You go into the med room, go into the break room, and then you can, oh my God, as much as you want. When you come out, you got to be professional, as much as you possibly can. So Epstein-Barr, we have this. Remember, I told you my first wife had it when she was, probably in nursing school. Okay, stress plays a role in that, because again, it lowers your sort of immune ability. And yet, when she got it, when 1989, so she would have been 38 years old. Oh my goodness. That was hard. 5 or 6 weeks of barely get out of bed. I think I told her. Cytomegalo has mononucleosis-like presentation. So probably when we're looking at these, it's probably in saliva and in secretions. Theoretically, it could be passed this way. We typically see this in immune suppressed individuals. Cytomegalo is not something that you would anticipate seeing normally, unless somebody really had a significant immunological disorder. When she got that adult mono, our family doc at the time was talking about doing titers for CMV, cytomegalovirus. The same. Turns out that we didn't have to go to that step, but there was a significant concern. Here's a very interesting one. Most of you had this. Nearly everybody has an exposure to roseola, human herpes virus number 6. Again, most likely through secretions. It can be spread respiratorily, coughing or sneezing or close contact. Roseola is a very interesting, we look at it as a skin disease. It's a very high fever. Parents go nuts. They think, oh my God, 104, 105, little kid. And then they take them and physician will take a look at them, or the nurse practitioner will take a look at them, and all of a sudden they'll start to see the fever will start to break, and you'll see a rash typically on the abdomen. That's roseola. They years ago, the name that we gave to measles was rubeola because the typical lesion, the typical pigmented lesion that was characteristic of measles was ruby red. This one was a little paler, so they called her roseola. That's the derivation of these names. And then all of a sudden, in this case, you get the high fever. The fever would start to break. You see a characteristic rash, typically on the abdomen, torso area, and the baby or the child would get better. Most of us have it. Okay, if you were tested to see if you had a titer, in other words, if you had antibodies in your system, most likely you'd be positive. Interestingly, they're continuing to study the link between certain titers and certain of this and MS. This is one of the things when they're talking about multiple sclerosis. Is there some type of relationship in certain individuals who have been exposed? And about 95% of us have been exposed to that particular virus. All my kids have this, which means most of you have this, because they may act differently, but they're just the same as you guys. Okay, and lastly, this one hopefully you don't see. This is an AIDS-defining diagnosis. We only see this in people who are severely immunosuppressed, and these days it's almost exclusively in patients with AIDS. An AIDS-defining diagnosis means if you are HIV positive and you develop Kaposi sarcoma, which is human herpes virus 8, then you at that point have AIDS. If you have developed tuberculosis, you develop certain types of fungal respiratory infections. Those are what are called AIDS-defining diagnosis. All that means is your immune system has collapsed, and now you're in a spell where effectively the HIV is no longer treatable when your life, and it's treatable, but you're going to die sooner than later. That's what the definition of fatal is. It's going to shorten your lifespan. It's interesting. When I tell you a little bit when you get to retroviruses in HIV, how all of a sudden people began to notice this very, very rare disorder called Kaposi sarcoma. It looks for all the world. If you go back and remember skin, you heard about things called melanomas, a nasty cancer you do not want to have. Okay, it looks a whole lot like it. Even though it is not a skin, it happens to deal with blood vessels. Sarcomas mean connective tissue, and this involved connective tissue that was associated with blood vessels close to the surface. More on that down the road. Okay, so that takes you through DNA viruses. Okay, boop, 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 boop. So we covered the herpetic viruses, the pox, the parvo. Effectively, again, is a non-enveloped. We associate another one of these interesting skin diseases that most kids had, all my kids had. And we will look at this again in skin diseases. So be familiar with these in general. That's why I sent you the study guide, because some of the students had asked me, which do we have to know all these viruses? I tried to make that claim. And as I begin to review the test materials, I will even try to be more thorough. So I can't expect you to remember all of these. I could try. She's looking at me going, okay, nobody thinks you're humorous ever. Moving on. RNA viruses. If I wanted to paint with a broad brush, the big problem with RNA viruses is they are genetically not as stable as DNA, which means, in a word, they mutate. And oh yeah, here we go. This is where we're going to see coronaviruses. We're going to see influenza viruses. We're going to see respiratory syncytial virus, RSV. That's kind of the big three that we see this time of year when we start talking about significant respiratory illnesses that are there. And the big problem in general with these is they mutate. Not all of them. Some are inherently stable. Polio is relatively speaking stable. Okay? And we're getting to that pretty darn soon. So we're going to look at naked varieties, and really it's just these first three. And they are extraordinarily significant. Okay, and then we'll get to the developed ones. They are extraordinarily significant as well, except These, because of the fact that they're non-adult, they're naked, we have to deal with that. And you can see a fair amount of these people here to SARS, COVID, et cetera, et cetera. When this PowerPoint was done, okay, they really had very little information about COVID, but that's where it is in the bottom. So I'll spend some time with that as well here. So we started at the beginning with this, and it's called rotavirus, infantile diarrhea virus. That aforementioned thing I told you about with my now 42 years old, my 42-year-old son, the one in the Navy. Take it from somebody who's done stupid things. This is a doctor and a nurse, my first wife and I. We went to visit our very close friends who we had adopted my son, and we wanted to celebrate New Year's, so we went to San Antonio, taking a 10-month-old. This is why you don't travel unless you know where you're going, even if it's in the continental United States. We were going to go to San Antonio. They were working, he was a pharmacist working in Del Rio, Texas, right on the border. We were going to go visit, probably going to Mexico, blah, 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 blah. Not a great idea. So we were there for maybe 48 hours in San Antonio celebrating New Year. They partied very well down there, right by Biol. And our friend's son and daughter, who were at the time like 12 and 13, were babysitting him at the hotel room, having a good time, all sorts of good kids, watching movies. And we came back, and this little boy, this 10-month-old, was throwing up and having diarrhea all over the place. Oh my God, high fever. We raced him to the Children's Medical Center. The name of it's in San Antonio. The name escapes me, but they're at their children's hospital. And we took him there, and they did just what I was telling you about. Eventually, to the point where they sent us home the first time. He didn't get better. By the second time in, they did a spinal tap, fearing that maybe he had somehow contracted bacterial meningitis. Thankfully, it was native. What he had gotten was rotavirus, known as infantile diarrhea viruses. It is endemic in that area. When you travel to an area that you are not from, okay, you have to be aware. And we heard a lot about this during COVID. At that point, in that part, because that was a virus that was endemic in northern Mexico and the southeastern United States. They had a term that you heard a lot. They were hoping for COVID called herd immunity. What that means is when about 90% of the people have either been exposed to it or have had that, effectively it kind of runs out of potential victims. Genetically, over time, people who have been exposed to this, they're going to pre-program antibodies that they're going to pass on to their offspring. So the kids there, that was no different than getting some kind of a stomach bug. But for someone out of the area who had never had that, okay, now it became very significant. And we spent a really scary, because he was in the hospital for 7 days on supportive measures, fluids, and I'm there. I was the night person. So I'd spend all night keeping an eye on him, barely sleeping, making sure everything was, have a parent there. And my first wife would spend the days there along with the folks who were part of it. That was not a great vacation, to say the least. And San Antonio is a very lovely city. Rotavirus is increasingly prevalent. We've seen a dramatic change sort of in the evolution of our population. Okay, we're starting to see this virus making its way up, particularly into the Northeast, like in this area. I don't think it's really here yet, but you should be aware. So the moral of the story is do not, travel with you shouldn't travel with a small child. I think you probably should wait until that age 2 if you possibly can. Okay, and if you're going to go there, that's that whole idea. The CDC websites, my students did it in the lab. Okay, cdc.gov. Pop in the destination where you're going, see if there's anything going on there, and maybe a reason to be careful. Maybe there's some precautions that. Yeah, I think they did develop an immunization for this. I do not know if it's on the immunization schedule. That's something many of you will get in nursing and other clinical things. Because it's naked, it's everywhere. A couple of days there, less than 48 hours, all of a sudden, he's really sick. Literally, potentially deathly. We're fortunate in that. Pico-RNA viruses. I always name it the corner. Understand, I saw a little bit of it before. The fact that that category is based on is it developed or not, is it RNA or DNA, not size or shape. These are tiny RNA isometric viruses. There are two basic subcategories of these. Rhinoviruses, rhino means nose, and by and large, that's a whole set of different, 200 or so different types that cause, you guessed it, common cold. Nothing worse. That's why we don't have an immunization. It doesn't pay. It's an RNA virus. It keeps changing. Sooner, we get colds. The other one are called enteroviruses that we sometimes erroneously call the stomach. Okay, entero means enteric. So these are respiratory spread. These are equal to oral spread. Enteric means your gastrointestinal tract. They don't all behave the same way. There are two really notable exceptions to that we have to talk about in here. The fact that they are in this category doesn't mean they are innocent. Perhaps the most notorious of these historically, polio. Polio is spread, and this is what people were totally unaware of. When someone got polio, you might remember me mentioning it before, back in the 20s and the 30s, they were shunned. They thought this was spread by contact or respiratorily. Okay? They wouldn't, if someone got it, they would avoid that family. People who worked in close contact with them would stay away from them. Oh my God, it's from contaminated water. Contaminated water supply. Famously, for President Franklin Delano Roosevelt, while he was campaigning, was doing a campaign stop with Boy Scouts and drank some of the water at a campaign stop when I think he was just governor of New York at that point in time and contemplating a run for president. That's how he contracted polio. Contracted from contaminated water there. We had no other means to treat it. It is still here. Don't think for a minute, but we have an immunization. That immunization was developed where? University of Pittsburgh. They didn't even know about the transmission. It was developed by an extraordinarily famous medical doctor, researcher at the University of Pittsburgh named Jonas Salk. If you have been at this university 10 years ago, we had one of our emeriti, in other words, professors emeriti, was here teaching micro to those classes. He worked with Salk back in the 50s when he just had graduated medical school. He's still around. He's probably about 90 or something like that. Doesn't teach here anymore. Just to give you an idea, Salk, the immunization that was given to us, okay, was by injection. That is not, and the reason why it was not as effective as it could have been, if that's not the way we get it by injection. Okay. People really didn't understand it. Subsequently, another researcher at Pitt, who I may very well have even been related to Salk, named Sabin, developed the vaccine that we currently use, and that is orally. Okay, to give you some idea, so approximately, so I had the immunization probably sometime in the 50s when it was developed. Until when they developed the oral vaccine, it's probably around, obviously because it was spread that way, it was a more desirable way to get it. And if you did not know, and you might ask an older relative, i.e. my kind of age, we had a nationwide campaign where everybody in the United States was immunized with this oral vaccine. We got Gives you an idea of how things have changed in this world. I can recall, and I'm telling you, it's like either 64 or 65, so I was 13 or 14, when we would all go as a family. We would go, whether it was the community center, ours was at the high school in our town in New Jersey, and all the doctors and all the nurses, as a community, would sit there with the rolls of census rolls, and you would come in, and they would have a tiny little cube of sugar that they put a drop, because it was red liquid on top of the sugar cube, and everybody took it that way. Well, we did this, I think, successively, approximately a month apart. Okay, to give you an idea how the world has changed, could you imagine a 13 or 14-year-old, a non-adult, not having their parents there? My God, the world would change. I was staying over at a buddy's house, and I remember his dad calling my dad and saying, "Hey, we'll take Lou over to the high school." And my dad saying to him, he goes, "Oh, don't worry, we'll tell him you're bringing Lou and everything's fine." How's that? That's exactly what happened. Can you imagine having that without, oh my God, now? Between HIPAAs and FERPAs and DIPAs and DIPAs. Oh my God. Liability. Oh, I can't give you, your parents are not here. We can't touch. Different world, everybody. Okay, but that's the idea. Polio is fecal to oral. What's unusual about it, it's not catchy at all. And once you develop polio, you can't give it to somebody else. It's active digestively. Okay, somehow it gets into your nervous system and damages the nerves going to muscles. That's how it works. So once you have it, you can't give it to somebody else. You can go back looking historically. It's called flaccid paralysis. I treated a lot of patients over the years with polio. You don't see it now. Trust me, if people stop doing vaccines for polio, you're going to start to see polio. Just what we're seeing now. I read an article this morning on outbreaks of measles, because people are, unfortunately, and we get into that chapter you were asking about, Sydney, with all that chart. We have to talk about preservatives for vaccines, and that's really one of the things that has caused people to be very reluctant for vaccines. I am not a proponent of all of the immunizations that they're giving. I will tell you that honestly. Did I have the COVID vaccine? Absolutely not. Did I approve of having to have all of you guys have it in order to go? I did not. But I understand when it comes to, when we're talking about measles, mumps, rubella, polio, that we have to have vaccines. So I'm an advocate of having children immunized. I think as adults, we have to understand this whole idea of having to be able to go to school or go to the workplace or serve in the military. There's some significant issues with that. That's my opinion. Okay, not fact. And I'll share it with you as we go on. Moving on. So that's the first one, polio. The other one, hepatitis A. Hepatitis is not created equal. Hepatitis A is fecal to oral. The worst outbreak in the continental United States happened Beaver Falls, PA, at a restaurant that's no longer with us, though they still make products under their label called Chi-Chi's. Back in 2003, that's 20 plus years ago, that company was unfortunately in bankruptcy. There were Chi-Chi's everywhere. Okay. And what had happened, unfortunately, because of that, how should I say, none of their doing. Okay. And people then thought, oh my God, they're terrible in Mexico and all this. It came from using, if you did not know, in Mexican cuisine, you tend to use a lot of green onions for garnish. Like you'll make a dish and you'll chop up the green onions and boom. Those green onions that you buy in the store, you go to Walmart and a little package of green onions, scallions, whatever you want to call them, spring onions, they're almost always from Mexico. They are supposed to be power washed. The same thing in the United States. Power wash means because they grow in the soil, you're supposed to get the dirt off of them. That's where it came from. It's fecal to oral. It isn't just because of people growing things in Mexico. If you go to the fields in California, same thing. There are no porta potties in the fields. Get the idea? It's not a pleasant thought. So next time you buy fruits or vegetables and it says pre-washed, did you see them wash it? I didn't. I get a great big colander out and I wash the heck out of it. I mean, I don't scrub it with soap and water. That would alter the taste. But I run it under water. And when I chop up scallions, I'll run them under water. I have a salad spinner we use all the time. We used it last night for dinner, all the time. So you can run it under, even though it's got that neat, that neat easy. Get the bag of pre-washed stuff, and go buy it. And you guys in your dorm, you can have it. Right? Don't trust it. I don't care what it says, triple washed or not. So what happened was, this is very similar to some of the problems we're going to address in the next category, which is norovirus, thalassemia. Someone had become sick there, okay, whether it was from those green onions or not. And by the time they're starting to shed the virus, in other words, they were feeling ill, maybe they had diarrhea, they were still working in the restaurant. All of a sudden, about 1,000 people were exposed. 4 people died. And it wasn't just elderly or very young. These were 4 people of different ages right here who had eaten at the restaurant. It was on the turnpike. It was a turnpike exit, the old Beaver exit. And people would get off realizing that there was a restaurant that maybe they wanted to go to when they were traveling. So very, very real. When you hear about hepatitis B and hepatitis C, they are in a different category. They are spread differently. Okay, hepatitis A, there is an immunization for. I do not know. At that point in time, there was not. There was treatment for it. Thankfully, most of the people did okay with it, but it bears being aware of things like that. I'm not saying don't go out to eat and go to places. I don't worry about stuff like that. I don't lose sleep over it. But if you start to get sick, make sure you get it looked at right away. Which brings us to this bad boy. You might have seen me being somewhat concerned on the phone from messages before we started. Okay, norovirus. Norovirus right now is everywhere. Typically we see it in the winter. It used to be called Norwalk virus. In the last 20 years, it closed down a Mon Valley school district. Because it was a small district, I'm trying to remember the name. It was a small district and all the food was made centrally, and the same kind of thing happened. Somebody got it, weren't necessarily aware of it. All the food was distributed, and by that time, they figured out that it was coming from their own food supply going to the high schools and elementary schools, small district. Guess what? They had like half the teachers and half the students were out. They had to close the district for about 2 weeks till people got better. Fortunately, no fatalities with this. This is the one we hear about a cruise ship being turned around, norovirus. I can't tell you how many times my wife, who worked in nursing homes, who worked at Cranberry's nursing home by Cranberry North, Cranberry place up where we live in Cranberry Township for 10 years, they would close floors because of norovirus. It's not good. Right now, and you've heard me talk about my ex. Okay, you're sitting there in the hospital at St. Margaret's because of norovirus. She's very, very frail. She probably doesn't weigh 90 pounds. She had a lot of illness, a lot of medical problems. That was so I'm texting with my daughter going, what's going on with your mom? Because I got a call last night from my son. She might be moving to ICU. She's not. She's someone who could get sick. She could succumb to that. Just to give you an idea how the severity of it. Did she pick it up when we were in Mexico? I don't know. Maybe she did. My granddaughter, who was with her most of the time, helping her get around, in the same room with her, also was sick, but thankfully now she's 23 and relatively healthy. Again, naked viruses. Easy to spread. You have to be concerned about them wherever you go. You can't make the point enough. And there's other viruses in that category, in the picoRNA viruses, that are pretty exotic. Names that you may hear about down the road, like Coxsackie and Kawasaki viruses. They are nasty. You don't want to even think about them. So when you see some exotic names of viruses, watch out. I know I've droned on a little bit about this, but it's super important because these are things you see all the time. So allow me to continue. Of this category, I mean, chikungunya is carried by mosquitoes, so it's zoonotic. Rubella is spread respiratorily. It is a very mild condition. It's called German measles. And we'll visit it again in the German measles line of things. Okay? Because we look at that as still considered a skin disease. The biggest single problem with German measles is damage to an unborn child. It spreads very rapidly. It spreads even before you know you have it. I had it as a kid. Okay. So when you hear about MMR, the big R for measles, mumps, and rubella is that. German measles, it's called a toga virus. It's enveloped. But when we look at it, it's very, very significant. You will hear me, and I'll reiterate it again when we get to that point. When we were in school, when we were kids, there was so much German measles around. Every class had somebody who had either hearing or speech problems. They wore hearing aids, or they had been affected. They would be going out for speech therapy. All of that, before that, the immunization for that was related directly to German measles, to rubella. Very, very significant disorder. Mild as anything. If you get it, probably wouldn't keep you from going to school. We'll talk more about that down the road. Flavivirus, Flaviviridae. Flavus means yellow. There's a vitamin called riboflavin. It's got like sort of a yellowish color when you have to give it to somebody, when you give like vitamin supplements to people intravenously. Okay. Just let me respond to that text. Noted. Continuing on. So when we look at this, okay, there are several in this category that are significant. They call it yellow fever because it impacts the liver, and we end up with, unfortunately, with liver-related problems that lead to jaundice, hence the name yellow fever. Hepatitis C is in this category. Dengue is in this category. Zika is in this category. Zika, dengue, yellow fever all have something in common. They are zoonotic. They are carried by mosquitoes. When you travel abroad, that is something that you have to be certainly consider. Okay. When you travel any place, if you're going to the islands, if you're going to Mexico, if you're going to some place in the United States where there's a mosquito problem, that we're pretty much on top of it. There's an old saying, control the vector, control the disease. That's why we spray for mosquitoes, if you did not know that, all the time. The one that is most significant to you and I is hepatitis C. When I first started teaching micro more than 20 years ago, I had to frame that argument that we did not have any effective treatment for hepatitis C. Hepatitis C is still the leading cause after alcohol for liver transplants, chronic liver disease, deaths from hepatitis, okay? And hepatitis C is a big association with liver cancer. Liver cells are about the most reproductive cells you have actively in your body with regard to an organ. This damages those cells and impacts that cell line, and they reproduce so rapidly, we see a lot of problems with that. Right now, we are starting to see a significant number of available antivirals. You see them advertised on TV all the time, so there is an increased amount of treatment. A lot of people have been exposed to hepatitis C. Okay, that was something that we saw particularly pre-1987 with regard to transfusions. So we'll talk more about that when we start looking at that particular category of things that are there. Hepatitis C is something that you must understand is very significant, particularly for you in nursing and in clinical fields, nurse practitioners. for anybody who's in a pre-health or pre-nursing career, when you have a patient who has what's called chronic hepatitis C, that means, for that matter, hepatitis B, we call that a chronic and persistent infection. We get to that in this chapter. That is always in your secretion. If you treat somebody who is HIV positive and you get a needle stick, the odds are about 1 in 500 that you'll get HIV. You get a blood splatter. If you have someone who has chronic hepatitis C, or what we call chronic and persistent hepatitis C, the odds are about 100% that you will be exposed to hepatitis C. That first wife of mine I talk about is a wonderful nurse who ran a nursing home for evenings and weekends in Wilkinsburg, the old Wilkins house, for 4 years. We are not sure if she got it from a blood splatter or not, but she did. She might have gotten it from a transfusion. I think that's more likely, pre-1987. But what happened to her was she didn't notice anything. She reported to her, she was a boss, but she reported to the directress of nursing for these places. Said, "Oh, you got him. Did you make that appointment yet for employee health?" No, but I will. And they made her an appointment. They do a panel blood test. They screen for HIV, hepatitis C, a few other things. Guess what? Hep C positive. Thankfully, it was just an exposure, and she made antibodies. That's what's meant by Hep C positive. When her health started deteriorating, and this was after we had separated and eventually divorced, my kids, who have a lot to do, who basically run her health care, there's like her health care power of attorney, effectively were told, listen, if she gets sick again, like Allah with this norovirus, that hepatitis C could raise its ugly head. Your immune system keeps that under wraps after you've been exposed to it. So, ladies and gentlemen, there's a wonderful line from The Godfather 2. Quote, basically, that saying, Michael Corleone asked this guy who's trying to kill him and take over, and he goes, who did this? He goes, I didn't ask why. I didn't ask who killed Mo Green. Okay, but I understand this is the business that we have chosen. You're going into healthcare. This is the business you have chosen. You're going to be exposed potentially to things. All you can do, you have a choice. If you're going to get in the field, there's a risk that you have to take the appropriate precautions. If you're overwhelmed, being afraid of being infected, you're in the wrong business. Okay? It's more important to help people. I keep telling you, before we knew any of this stuff, ignorance is bliss. Somebody would come in bleeding. I told you, we would, no gloves, no gowns, no masks. Boom. Put your hand over it, go wash your hands. I can't tell you how many times I did this. I had my hands in people's bodies, trying to keep them from bleeding out. Somehow I've made it to nearly 74. The diseases were still there. Okay? Still there. So I want you to be aware of those things. That takes us here. It's probably a good place to stop. So this is kind of where we do things like this. We will look at the coronavirus. We'll start with that next time. I do a couple more things. Now, after this, the ones we have to pay, rabies and Ebola, are relatively quick to talk about. The flu we have to spend some time with. We'll talk a fair amount about this HIV. Lassa, very little about Hanta, and we're almost done with all of this stuff. So we'll get that all done on Monday. I am fairly certain. Thank you very much.